It's difficult. I know people are very concerned because this particular variant, which has been under monitoring, has 32, I believe, changes in the spike virus through mutations, but it's only occurred or been identified in a small number of people. I think there's about 11 people in the South Africa and, of course, a couple of travelers. So at the moment, it hasn't yet established as a circulating virus outside of South Africa. And look, we see mutations all the time. So today there will be a meeting to decide, is it a variant of concern or a variant of interest, or is it a variant that just needs to be monitored at the moment? The 32 mutations, they have a couple of these mutations have very important impact on the ability for the virus to bind cells, our cells. It would appear as it also has the mutations that have the ability to get around our immune response when we do see the virus that has been built by vaccination. Now, if this variant does impact the vaccine efficacy, then it will likely be put into at least a variant of interest. And, you know, most of us have had a messenger RNA vaccine, and that looks at the spike. And with these 32 spike mutations, we still need to be told whether or not the vaccine really will be impacted severely by this particular mutation. And then how important this mutation is for spread. So that'll be something else that the World Health Organization will be thinking about. Does it cause more infection? So is it more infectious? Does it impact the vaccine efficacy? Does it impact death rate? Does it cause more deaths? Has it changed somehow where it evades testing? Now, the interesting thing, but not so good interesting, is that one of the travelers who went to Hong Kong from South Africa didn't test positive on the first day of his PCR test, but tested positive on the second day at an enormously high viral load. So if you took just one person as an example, and hopefully it's an unusual example, right, then this virus may spike, dramatically fast. That at the moment, even with the variants of concern, we still, who are vaccinated, have much less risk of dying, much less risk of severe disease and hospitalization. And in fact, one small study in the UK identified that people who were vaccinated had around 75% less likelihood to acquire infection if there's an outbreak in a family cluster.